Okay, so this video is my evaluation of my second client. And like I said in the other video, there are things related to our health are constants and some are variables. Constants are the things we can't change and are technically out of our control, but we can try and manage them. But to remove them completely can often not be possible. On the other hand, a variable is within our control and they're all affected by our lifestyles, meaning we can change them so they will no longer be a cause or a cause of our health problems or a threat to our health. Um, yeah, and a majority of these, as I said in the last video, will have a chance of someone developing heart disease or other sort of serious illnesses or diseases like that. And we're going to start by looking at his health tests, and his resting heart rate for his age falls into the average category, which is not terrible, but it's clear that this needs some improvement, as if there isn't any improvement made, it could lead to it getting even worse, and therefore increasing risks of other health issues, especially heart disease as it's related to the heart. Dave's blood pressure does fall into high blood pressure, which is obviously an issue, as high blood pressure can lead the cause of serious health issues such as a stroke due to arteries and vessels becoming clogged or narrowed and therefore restricting blood flow to the brain and therefore causing the stroke. It can also be another factor in the development of cardiac heart disease, as it causes the arteries to stiffen so they aren't supple, meaning blood is not pumped through them effectively, leading to further clots around the heart. So his lung function was very poor, like absolutely terrible. As you can see on the graph, the red mark is where he should be. That's how much he should produce for his height and age. But the yellow mark is where he falls, which is very below average, like really bad. And he should probably consult his GP and see if there's any underlying respiratory issues. But it's also possible that by changing certain like parts of his lifestyle, this should improve, such as smoking, as we do know that he smokes. Dave's BMI also further shows that his health is not of a very high standard. He falls in the obese category for his height and weight. Obesity is known to cause many other issues in itself. High blood pressure, which in turn has been said to lead to early clogged arteries, which leads to heart disease, as I said earlier. It's also been associated with some types of cancer and the development of diabetes, which he did state he'd been told he was close to developing. It can also affect your physical health. You're carrying a lot of extra weight. It puts strain on your muscular and skeletal system, which obviously makes everyday life tasks more difficult. Dave can reduce his weight by also further changing more of his lifestyle factors, which we should look at a bit later. And the result of the final health tests were also very poor. This was his hip to waist ratio, which falls in at-risk category, which means he's carrying a large amount of weight abdominally. This has been linked to the development of health issues, again, one of which is also heart disease, meaning he seems to be of quite a high risk. From all the health tests that I've done, everything I've seen, he seems to be of quite a high risk of developing heart disease if some significant lifestyle changes are not made. Now we're going to look at the strengths of his of the questionnaire that I got him to fill out. So his goals, they were very realistic. There shouldn't be too many issues with him achieving them from the information I've received. His doctor was aware that he's going to be completing physical activity, so that's not too much of a problem. He said himself that they're very important, which is always a positive thing with a client, as it usually means they'll be willing to put in the work and work closely with you so that if any changes are needed, they can be made effectively. Although currently he doesn't do any physical activity, he stated that he used to enjoy playing five-a-side football, which is a positive. He knows that he likes something and he has a passion for it. Makes it easier getting him back into something, as unlike someone who's never had any interest in activity, there is some level of motivation there. He also stated that he likes the idea of physical activity, which is obviously some sort of a starting point. There's some motivation somewhere. He doesn't hate the idea of it, meaning he'll probably be willing to work towards where he wants to get to, even if it means exerting himself. His hours of sleep were within the recommendations from the NHS. He gets 8 hours. The recommended for an average adult 7 to 9 hours sleep minimum. He rated his confidence 5 out of 10 as well, which is pretty average rating and not a major worry. And to be honest, it should hopefully improve with all the other change. If he makes all the other changes needed, confidence is likely to improve if you feel better in yourself. And a strength of his physical health was that he said he had good upper body strength, and this is most likely due to the fact that he does quite a bit of heavy lifting in his job. So yeah, there weren't a huge amount of strengths. There's a lot more areas for improvement, which we'll look at now. Although it's not something that currently needs improvement, his goals will need a large amount of consistent hard work for them to be achieved. There's no room for any slack if he wants to achieve them. That's not to say that they aren't achievable. They very much are, but he just can't decide one day he wants a day off. It has to be completely consistent or he won't achieve them in time. The whole of his physical activity section needs improving. He doesn't do any, so he needs to start by having a baseline of completing physical activity twice a week, especially something cardiovascular, but he also needs to not push himself too hard, as he could cause health issues or injuries, but also damage his confidence due to all the other factors that I know about. It is likely that that could happen if he pushes himself too far. The entirety of his nutritional status also needs changing. He needs to eat 3 balanced meals a day, reduce his level of snacking, change what he's snacking on, and needs to stop consuming so much fast food. He's consuming way over his fat and sugar intake and therefore going over his daily calorie intake. He also needs to reduce his units of alcohol slightly, as they are slightly over the recommendation of the NHS of 14 units a week. He consumes 17, which is not awful, but obviously there's a recommendation from the NHS. It probably needs changing. His lifestyle also needs some significant changes. He needs to start trying to quit smoking. This can be a very tough process, but by starting gradually and decreasing how many he smokes a day, that will already have some benefit. As it decreases more, it obviously have more benefit. His job is also very sedentary, which obviously he can't change very easily, so he needs to make sure he does partake in some physical activity to start to counteract the fact that he's sat down for a majority of the day. Finally, he needs to reduce his stress levels, as this will be putting extra strain on himself that he does not need with his current health status and in all the rest of his elements of life. They'll be further increasing his chances of things such as heart attacks and of actually developing heart disease, and stress in itself is a mental health issue that needs strategies to help manage it. He has an outstanding back problem, which he needs to seek some treatment for, as he hasn't had any. And if that's improved, it will make his job easier with all the lifting and also reduce the physical pain he suffers after physical activity, because his back will become stronger, will therefore be able to deal with the strain he puts through it on a daily basis. All of the areas that need improving from his medical history will be improved and prevented if he does everything else he's supposed to do. It's all his lifestyle choices that are causing these risks to his health. So if the changes are made, then these factors won't be such a risk to his health, which is obviously a positive thing.